There is now uncertainty as you see clouds festive travel plans as COVID-19 infections continue to rise. This as South Africa is experiencing its second wave of the coronavirus pandemic. And when he addresses the nation this evening, President Cyril Ramaphosa is expected to shed some light on how government is planning to tackle the COVID-19 resurgence. For now, more on this, we're joined by Professor Alex van Heever, the chair of the field of Social Security Systems Administration and Management Studies at Wits School of Governance. Prof, welcome to the program. What does one say? We were promised that it's going to be a Christmas or a festive season with a difference, and we're seeing it right now.
Yeah, it's always going to be difficult, and I think that right from the beginning, we had to understand that the virus is going to be with us until we have a vaccine that eliminates the risk, or we achieve herd immunity through infections. But that means that for that to happen, it would be with us for many, many years. So I think this is, we kind of have to expect that there are going to be resurgences, and they're going to occur for particular reasons. And I think that what we're seeing now is the consequence of having become a lot more relaxed for a period, and conditions for super spreading have consequently been created. Yeah. So I think that this is not unexpected. This isn't the second wave. This is a resurgence, which will happen at any point that we let our guard down.
I mean, if you look at the numbers, yesterday we broke the 20% increase, daily rate increase. KZN hit the 2,000 mark, and they have over 70,000 cases. It's scary when you look at what is happening, and you mentioned that it was inevitable to get the numbers to increase. Super spreader events like we've seen, especially with the young ones, matriculants are back at home, varsity students also making their way back at home. How big of a role did they play in this?
I think they have a big role to play in it, but those events are the ones that we know about. I think that there were many equivalent types of events happening all over the place. Would be gatherings where people have become a lot less cautious. Indoor settings where people are without masks, potentially drinking or socializing. Those are, if it's an event like that with 20 people and you had one asymptomatic positive in that group, they infected maybe 2/3 of any group like that. And I think that we've been having these gatherings occurring. The rage parties, I think, exemplify this. They're just an extreme version of what has probably been quite general. So I think that going forward, we do have to learn how to manage these exceptional instances where super spreading is a very high risk. There's a very high risk of transmission. We need to manage those settings effectively going forward. Otherwise, we will continuously see these resurgences occurring.
Listening from what you're saying, I get the feeling that you believe that the numbers could be higher than what is currently being reported.
I don't think so. I think that we're certainly tracking the epidemic. We're tracking a significant increase. It's now across all the metropolitan areas that we're seeing it. So eThekwini, Johannesburg, bits in Tshwane coming through, even places like Witbank, you're seeing a rise. And I think it's because of this relaxed behavior. So I think that this is coming through, and if we don't, certainly, I think a number of us have argued for managing this epidemic by way of exception, dealing with instances where super spreading is a risk. And if our general non-pharmaceutical interventions, our protocols are in place in many settings, as they are in hotels, as they are in many restaurants, we should be fine in managing the epidemic. But if you combine that with allowing these events to occur where people basically act as if there's no virus, then we will have these very large increases in prevalence, the number of active cases that are available, and that increases the risk for everybody. So I think we have to look at how we manage those specific contexts. It doesn't mean that we have to go back to a level 5 lockdown or those kinds of measures. They're not very effective. What we have to be doing is focusing on the high-risk areas for super spreading, and even beach areas are not high risk for super spreading. A high risk for super spreading is an indoor setting where people are essentially concentrated and where one person will infect 20 in one sitting.
That was the question I was going to go to. The planned or the proposals to shut beaches, a lot of people say, but that's not where infections happen. Beaches are outside, you're getting fresh air, it's well ventilated, you're getting your vitamin D as well. Concentrate on where you'd have people, whether it's saying cut down the numbers at churches, go back to cutting that down, cut down the number at beer halls, or cut down the number at restaurants, rather than shutting off a beach where literally you could be safer than being in a restaurant.
Yes, I mean, if a transmission is going to occur in a beach area, it's going to be, maybe a very small number of cases that are where the disease is transmitted. But one person in an enclosed setting will infect a very large number of people. So the beach setting isn't the high risk area. What might be high risk in a beach area is where you do go to a restaurant which isn't properly managed, or you do use public toilets which aren't properly ventilated. So what you want to do is manage those high risk those spaces and make sure that people are reasonably spaced in a beach area. But yeah, that is a much lower risk of transmission than many of these other areas. And the issue is those are the areas that we haven't actually been controlling up at this point, including taxis. Are they properly ventilated? Do they have their windows down because we've allowed them to travel with 100% capacity? Are people wearing masks, their own masks, or are they sharing masks? It is shebeens, it is pubs. It's those areas where there would be a risk if it's indoors and not properly ventilated. So I think we must prevent an overreaction on areas that are not high risk and focus on those exceptional instances which are the cause of most of the new infections that we're seeing.
Let's speak about the vaccine. On the continent, Africa, we know that it could be some time since we see one. We've seen the Americas, Europe, some of those countries have started vaccinations. Your thoughts here in South Africa, how well and how are we ready? Let's say we get the vaccine tomorrow, because it's not just getting the vaccine, is it? It's being able to roll it out to the populace in a well-strategized manner. How do we go about it if we do get it anytime soon?
Well, the vaccine, first of all, has to be approved by our regulatory authority, SAPRA. And there's no clarity at the moment of the process from kind of registering the vaccine to some sort of rollout program. There is no explicit strategy that is public. And it's unclear whether or not we've got a coherent plan going forward. I think there's a lot of uncertainty about it. A number of scientists have raised their concerns, including people who are currently running clinical trials for vaccines being tested in South Africa. We have to move rapidly to approving those particular vaccines, and then we have to have a plan for rollout. And it would be really important that we roll out the vaccine probably before April, May this year. Because although we're having a resurgence now, this might die down because it is summer. This is the easiest period in which to actually contain the spread of the virus, and we probably will contain this particular resurgence. But when it comes to winter, people are in enclosed settings, and it's very difficult to control the risk of transmission during that period. And if we don't have a vaccine by April, May, we will be facing a very severe resurgence again. So I think it's very important that we try as early as possible to get a vaccination program going before that period. But it's very unclear that we are at that state of readiness at this point.
And the numbers speak for themselves. I mean, you mentioned that we're in summer. If I'm just looking at my graph here on the computer, places like the Northern Cape, they've had the least number of cases. I think only like 23,000 total cases. They've got active case of 2,100. Their recovery rate is 89%. I mean, across the board, South Africa's recovery rate looks good. The problem that I've always had when you do these interviews is that people are so lax. They will tell you that I've got 92% to recover, and the issue is not them, is it? It's that 8% or 7% that will not recover, which is why we're insisting on wearing masks.
Yeah, so it's a disease that people who have comorbidities and at high risk, older, with compromised immune systems, they will develop severe illness. And what we are seeing in South Africa is that it does if we have a huge surge in the number of infections, it's sufficiently large for us to overwhelm our hospital systems or to get very close to the point where we're overwhelming them. If we had to look at our excess deaths in South Africa, the excess death information suggests that a lot more people died than we've reported as COVID deaths. And if we had to look at those excess deaths and assume that they were actual COVID deaths, it appears as though we didn't actually treat many people in our hospital system, as many as we should have. And so not everybody who develops severe illness ends up getting to treatment. And the case at the moment in the Eastern Cape is that a lot of people are getting to treatment very late in the day, which means that the hospitals also can't intervene early enough to save people. And as a consequence, they die when they could have actually been saved as well. So all of this means that our hospital system has to be sort of at a state of readiness, and people have to be aware of when they need to come in relatively early to manage that particular risk. But I don't think that first of all, the numbers are unclear and don't appear to make sense in that there are potentially many more cases that are in hospital than are being reported as in hospital, but in the public sector. And I think we need to be very, very concerned about the severe illness that's developing in the high-risk groups. And there's clearly underreporting in a number of provinces.
Professor Alex van den Heever, thank you very much for joining us, the Chair of the Field in Social Security Systems Administration and Management Studies at the Wits School of Governance. Important topic you mentioned that. In fact, we're going to have a discussion a bit later on with Denosa, Prof, with regards to the field hospitals in South Africa that were once open and running at the peak of COVID-19 just down the road from here, the Nasrec Center. We know that Durban shut down a couple, Pietermaritzburg, the Eastern Cape. What happens to those now? Will we see them being reopened? What happens to the ICC in Cape Town? Will that be reopened following the surge in numbers? That's a conversation we'll have a bit later. Thank you very much there, Professor.